Managing coughs, sore throats, runny noses, and headaches are common symptoms, especially during the winter. Doctors say Group A Streptococcus could be the culprit.
It's pretty common when you think about strep throat.
But invasive Group A streptococcal infections, commonly referred to as iGAS, can be deadly.
The severe infections, the invasive strep A infections, remain rare, but we certainly see a trend towards increasing cases.
Health Canada says an early snapshot suggests disease activity in 2023 is higher compared to pre-pandemic years, particularly in children under 15 years of age. In 2023, Nova Scotia reported 94 cases, the highest number in 5 years. PEI also saw an increase, reporting 28 cases, mainly in adults. In Alberta, there were 739 cases compared to 434 the previous year.
Because the data is tracked by calendar year, some doctors say it may not capture current iGAS trends.
Group A strep does not necessarily have a seasonality, except in the setting of it being a serious secondary infection on top of a respiratory virus that does itself have a season, and we're right in the middle of that season right now.
Towards the end of December, the BC Centre for Disease Control issued a notice about cases of iGAS on the rise in children after 2 deaths were reported. Dr. Brian Conway says those deaths involved compounding factors.
The 2 cases that occurred that led to the death of the children was an initial respiratory infection with influenza that was particularly severe. And on top of that, there was a secondary infection with a bacteria, Group A Streptococcus or Group A Strep, that unfortunately led to their demise.
Infectious diseases physicians say Strep A can often be treated with medication, and the most important thing to remember is to seek medical help if symptoms get worse. Katherine Ward, Global News, Toronto.